and I am here today with three lovely ladies to talk about communicating with geriatric patients. So if you guys could introduce yourselves and tell us what you did as a career and maybe where you live.
Okay, I'm Patty Hughes, and I was in education, both in teaching and administration, both at the public school level and then at the university level.
I am Linda Cooney, and I worked at the REMC for 28 years. And then I took early retirement there and was partner in a small business, a storage business. And now I just get to be a volunteer and do kind of what I want to do.
And I'm Rosalie Spar Alexander, and I taught elementary school for 37 years. Loved every bit of it, but I am so glad I'm retired. And I can do whatever I want to do and get up whenever I want to get up.
So we are talking with you guys today about communicating with geriatric patients with healthcare providers. So just in your guys' opinion, who would you rather talk to? A pharmacist, a nurse, a doctor, or some other healthcare professional?
Well, it would depend on what my issue is. If it's a medical, physical issue, I'd want to talk to my doctor. But if it's something like some medicine that I'm taking and want to know if it's going to be the best medication, like for my arthritis, or is there something better, then I would talk to my pharmacist. Depends on the issue, I think.
Mm-hmm.
Today at lunch, I asked one of the elderly folks at the table, or I was talking to several of them, but on that particular question, it was interesting. She said, I like to talk to my pharmacist because that person will come to the phone and I am one-on-one. And I was thinking that goes back to probably our era where doctors still made house calls a long time ago. And you did have very close personal contact with your healthcare providers. But it was interesting. She said, I would probably, whatever the issue might be, I might talk to the pharmacist first before I go further.
Okay, so are there any personal qualities at all that you guys see in your pharmacist or your doctor, anyone that makes them easier to talk to?
Well, in this small town, they know you by your name.
Mm-hmm.
I mean, it's on a first name basis. And I can go to the pharmacist and he knows me by name. And, good morning, how are you today? And very, very friendly. And the same way with the doctor and his nurse. Because it's a small town. Had it been a larger city, Chicago, New York, I don't think we would have that same relationship.
Same with you guys, just the personal contact and knowing them makes it just a lot easier to talk to your pharmacist or doctor, whoever it is.
That and not feeling rushed.
Okay.
That's a good point.
Do you feel like people do rush you a lot when they're trying to just get in and talk to you and push you out the door, or?
Well, they're busy.
Mm-hmm.
And that I if they just talk to me one-on-one for just a short time, then I'm fine.
Mm-hmm. Okay.
Mm-hmm.
I appreciate the fact that my doctor treats me as an equal and doesn't talk down to me. And because we do know each other personally, he knows that, and some might dispute this, but that I still have my faculties. And and he also knows that I'm not hard of hearing. That's one of the things that often happens with an elderly person. Because you are elderly, others will assume you can't hear, and they're talking very loudly. But, with our doctors knowing us, they know that's not the case. And I find him to be very empathetic. Would you agree, Rosalie?
Oh, we have the same doctor.
Same doctor.
He knows I'm a worrier. So, he's very caring and doesn't put the fear into me about any issues, because he knows that I worry, and he knows that about me, and I appreciate that.
I feel like he's very respectful of his patients, which is, a critical aspect. He's also a problem solver, critical thinking, problem solver. And what I really like I recently changed doctors, but what I really like about him is that if I have a problem, or I perceive that I have a problem, he takes it very seriously. And it's not going to be just another pill. Okay, let's see if we can get x-rays, or let's see if we can get approval for an MRI. He acts on it.
Okay, so next question. Do you guys feel like you have been treated differently by providers as you have aged? So as you've gotten older, has anyone progressively treated you differently because of your age at all?
I don't feel like I'm treated any different as I've gotten older.
Okay.
But the medical field itself, just the legal end of it, the red tape of it, has gotten harder.
Is it frustrating that do you not always know what's going on, or?
I don't think I see the frustration, but I worry about the people that work there, what they have to go through just to get a little thing done.
I don't feel like I've been treated any different.
I don't either. All patients should be treated with dignity and respect. And I feel like that's the way I'm.
Of course, I feel like I've been older since I've gone to him.
Well, we have been. Yeah, I think another piece here is that a patient should be treated in terms of the clinical history, not the age part of it.
And that makes sense. I mean, just because you have hit 70, like you were saying earlier, just because you hit the age of 70 doesn't mean you have hearing loss.
Right.
And somebody who's 40 could have hearing loss. So you do need to treat the clinical presentation instead of treating a person's age. And that's definitely something that my article was trying to hit on. Just that you have to treat the patient, not the illness. Right. Or treat the illness, not the patient. So do you guys have any advice for providers when they are talking to an older adult at all?
My mother is going to turn 94 in a few days. So for probably the past 4 years maybe, I've always gone to the doctor with her. And I have a brother and a sister, but I'm the delegated doctor office person, so that one person knows what's going on. And I think that's important, but most of her doctors are aware that they're not just talking to me. She's in the room too. And we've been to probably 6 different doctors, from time to time. And they're all good about making sure that I'm aware, but also including Mom in to know what's going on. And I appreciate that. But I do keep good records of it so that I can remember. And if any of my siblings would have questions, then I'm there with the answer to know what's going on. So that would be my best advice, I guess. Sometimes 2 pairs of ears are better than one, especially if you're sick and not feeling good, to have maybe somebody with you.
It's also important for me, for the provider, to maintain eye contact. I just think that's an extremely important characteristic or quality. And I also want my doctor to be on time, because I feel like my time is also valuable. And it can be very frustrating, as we all know, to wait and wait and wait. But then, on the other side of the coin, is that they have emergencies too. So if I'd ever have an emergency, I would.
They might be taking more time with us
Well, that's true. Yeah.
than
Yeah.
on somebody else's wait.
Yeah. And you're right. You're right. And one of you mentioned listening. I think that's very important, that you feel like they're really listening. They're empathetic and they are compassionate.
Okay. Do you guys have any advice as, we're going out and gonna be practicing and we could be your next pharmacist? Do you have any advice for any Butler students or any medical students in general before we go out into practice and go out into doing anything? Any other pieces of advice for us?
Something that is just a real turnoff to me, and I don't notice it with pharmacy or doctors, but sometimes nurses, their pants are so stinking long and they're dragged the ground and they're dirty. And to me, that's
So look good.
Cut them off or do something.
That's a good point.
But honestly, you're a healthcare professional, and to me, that's just a big turnoff.
Okay.
You need to look good.
Really good point.
Just smile, smile, smile.
Yeah.
When I go over there and, they're just so kind. Good morning, how are you today? And, I appreciate that. Because you can be not feeling very good. And of course, here in this town, they can know you by name.
Yeah.
Hi, Rosalie, how are you? But, in a bigger city, of course, you couldn't do that. But any kind of personal relationship that you can associate with them, I think is good,
Also for graduates, I think demonstrating integrity, which is, that was always one of my final interview questions with a candidate for teaching, was what is it that you want, what makes you stand out from any other candidate? What do I need to remember about you? And often, I shouldn't say often, but in several instances I got the word integrity, which I think is critical. And then the interpersonal skills are going to be critical to the graduate. Work ethic, work as hard as you can, which as pharmacy students you will do because you've been doing that. But that's critical too. And I think for the graduate, find yourself a mentor in your work situation so that you can bounce ideas off of this person. Practice critical thinking skills with that person. And just be on top of your game. Be passionate about your work. I don't know that in my work that I ever didn't want to go to work. Well, there might have been a few days.
Come on. There's a few days.
Maybe a few days, but I loved it. I loved
I
it.
love my work too. And you have to love what you do.
You do.
I taught at school for 37 years, and you have to love what you do, or you can't do it.
Do you guys have any last remarks about anything?
I'd just say I'd rather have 5 good minutes with somebody one-on-one than a rushed hour. Just patience and eye contact, and to remember to talk slow.
I just don't want to be looked at and treated old.
Understandable. Definitely understandable.
I definitely feel that way. And I will interject here, this isn't necessarily medical, but please don't call me sweetie or honey. It's very hard on me. And this often happens to an elderly woman that you're called that. And Rosalie well knows that I don't like that. But it's been a pleasure today to have this session.
Well, thank you guys for talking. I appreciate it.
Wish you well.
Thank you.
Yes, we
You do
certainly
well.
do.